I'm pleased to welcome Tony Keating, the CEO of ResApp, to the Morgans Network. Tony, welcome. Wondering if you could tell us firstly about the ResApp technology.
Sure, Scott. So ResApp is all about diagnosing respiratory disease, and the way we do it is quite unique. So we diagnose respiratory disease using the sound of one's cough. So essentially the technology is you cough into your phone, and the phone is able to tell you which respiratory disease you have: pneumonia, asthma, bronchitis, croup. And so the technology is really unique in that we can deliver it via software only to everybody who has a smartphone in their pocket. Okay,
so you've got some clinical trials underway. What are you expecting to find out, and when are those results due?
Yeah, so that's right. So we have a multi-site clinical trial underway here in Perth, or over in Perth at the moment. So that trial is looking at a paediatric population of kids between 0 and 7 years of age. That trial has been running since March, and we have around 250 plus patients through that trial to date. We will present some preliminary results for that trial this quarter, and those results will give us an idea of preliminary results about diagnosing certain respiratory conditions. As we move through to the rest of the year, we'll end up with over 400 patients and a much more detailed idea of what those results are looking like.
Okay, so to get the product approved, what sort of process do you need to go through?
It is a true medical device. So we are going through an FDA 510K process, either a 510K or a de novo 510K. We've just engaged US FDA consultants who are working with us now to put together a package to go to the FDA for what's called a pre-submission meeting. And so during that pre-submission meeting, we will get the FDA to verify that our protocols and our clinical trials are all correct. And then we'll take that further through to an FDA 510K submission with the aim of getting that approved by the end of next year.
Okay, so assuming all that happens, what is the business model and how do you actually monetize and get paid for this test?
So the really unique thing about what ResApp's able to do is that we're able to leverage the growth in telehealth. So in the US, we're seeing a significant number of people seeing their GP through a video link, through a video consultation. And that has a massive issue there, in that diagnosing respiratory disease is very difficult over that video link. You can't put a stethoscope, you can't send someone off for an x-ray. So we see a very unique opportunity to form B2B partnerships with telehealth providers so that they provide the test to their patients, and then we will take a per test fee for each test that's performed.
Okay. So who else is doing this in the world? It's obviously a new area and it's expanding very quickly. Who are the other players?
So we don't see anyone in the respiratory space that doesn't require additional hardware. And that's one of the keys to our value proposition, is that we can access everybody who has a smartphone in their pocket. There are a number of companies now operating into diagnostics and providing remote diagnostic capabilities with add-ons to phones. So there's companies in the US who are looking at ECG monitors over a phone, looking at otology, so looking into the ear and taking camera pictures and things like that. But we see one of the big differences that we have is that we don't require any hardware. Anybody who's got the phone can use it, so we're immediately accessing huge markets.
Okay, so Tony, could I just get you to try and summarise what are the milestones coming from ResApp over the next 12 months? So from an investor looking to buy shares in ResApp, what should they be looking at?
So the first milestone we have is coming this quarter, so in the next couple of weeks we'll be releasing some preliminary results out of our trial in Perth. Following that, we'll be kicking off an adult study, likely here in Brisbane, within the next month or two. By the end of the year, we will have our pre-submission meeting with the FDA, which will give us very good guidance on a US clinical trial, as well as the final submission for the FDA. We plan to submit for the FDA by early to mid next year, and that will provide us with that, a final FDA submission, and then hopefully approval by the end of next year.
Okay, that's great. Well, some good milestones to look forward to. Thank you very much, Tony from ResApp. Thank you for joining the Morgans Network this afternoon.